In a world filled with major existential problems, there are numerous psychological illnesses individuals encounter. However, if you ask yourself, what is the illness that accompanies individuals from the very moment of their first awareness? The answer is undoubtedly depression. This is why the book Understanding Depression by the psychologist Kwame McKenzie exists. It aims to define this serious psychological illness, divided into chapters that seek to explain this deadly condition, its symptoms, problems, and how individuals can help themselves in the healing process. This is depression, and this is the book that will convey to you a unique experience to overcome it, based on the studies and practical experiences accumulated by Dr. Kwame McKenzie. Understanding Depression by Kwame McKenzie. Many people wonder about depression because there is significant overlap between it and other forms of human anxiety. Every person in life faces misfortunes, challenges, and obstacles that hinder their aspirations and hopes, making them susceptible to anxiety, fatigue, deception, and mood swings. Is all anxiety depression? Certainly not. Therefore, it was necessary, as Dr. Kwame McKenzie pointed out, to clarify that depression is a mental and physical condition that confronts the human being during their journey in life. This condition creates symptoms that vary from person to person, but often share similarities. What are the most important of these symptoms? Mood disturbance. Affected individuals experience a bad mood, losing the desire to continue living. Loss of pleasure and enjoyment in life's pleasures. Mental distraction and loss of the ability to concentrate. Delusion, hallucination, and a desire for suicide. Sleep difficulties and loss of appetite. Although depression is a widespread phenomenon, with a large segment of people suffering from it, its precise causes remain completely unknown to many researchers and scholars. This is because the psychological conditions individuals go through vary from person to person. Each person is an independent case, despite many similarities and intersections. However, this does not mean that we cannot identify some of the leading causes that contribute to well-known and famous depression cases, including deficiency of certain chemicals in the brain, as the human brain is composed of millions of nerve cells, requiring many chemicals called neurotransmitters to transmit movement or specific commands. The role of hormones in the depression process. Psychological stress and exaggerated tension lead to the release of corticotropin, responsible for secreting the cortisol hormone that causes anxiety and tension. The death and growth of brain cells. Psychological stress and tension also change the structure of the brain. Bit to remember, depression has physical and psychological symptoms that must be recognized, and it alters the body's structure, including the human brain. Sometimes, the causes of depression are clear and known, such as losing a job, a loved one, a friend, or a special place in one's heart. However, even doctors and researchers often struggle to identify the reasons behind some cases of depression due to their complexity and ambiguity. There are often other factors contributing to severe depressive episodes. Among the most significant are genetics. Understanding how genes work and how they lead to depression is challenging for researchers and doctors. It has been found that individuals may not necessarily develop depression if one of their parents has it, but the likelihood increases, especially if the affected individual is a twin. Family environment. As the saying goes, a person is a product of their environment. If the family atmosphere and the closest surroundings are afflicted by depressive episodes, the likelihood of experiencing depression increases compared to situations where the family environment is free from such conditions. Childhood sexual harassment. Numerous studies have shown that a majority of individuals suffering from depression have a history of unpleasant memories related to childhood sexual harassment. Psychological illnesses often result from negative beliefs, attitudes, or behavioral patterns. These deviations lead individuals into the clutches of chronic depression and chronic anxiety, intensifying stress and human misery, causing complete detachment from reality. But how can a thinking pattern lead to a mental illness like depression? Here, we can observe some thought patterns that can lead to depression, creating motivation for a person to succumb to stress and chronic anxiety. The most important ones include lack of control over fate, when a person cannot overcome prolonged periods or continuous obstacles in life. Chronic diseases. prolonged illness creates chronic despair and difficulty in accepting a self-imposed situation, making the person vulnerable to depression and anxiety. Psychological pressure and life issues, the challenges imposed by reality, with its harsh conditions, may become a cause of depressive episodes. Bit to remember, there are many factors causing depression, making diagnosis challenging. Depression often results from patterns of negative and destructive thinking. Like any disease, depression has various classifications and multiple types. These classifications are important methodologically, as they allow us to measure the magnitude of the disease or the risk that any of us may encounter in life. The book emphasized this type of classification, and it came as follows: mild depression, natural conditions that anyone can experience with very limited levels, given the pressure of life. Moderate depression, here, a person becomes moody, with a worsening temperament and physical symptoms appearing. Medical assistance is required at this stage. Severe depression, life becomes entirely threatened here, and the psychological well-being is imbalanced, accompanied by tension, hallucinations, and delusions. Chronic depression, this type of depression persists in some individuals due to specific reasons, becoming like a chronic illness that coexists with the individual, becoming part of their psychological and physical journey. The experience of depression is bitter but not impossible. The book addressed treatment methods but through psychological assistance in overcoming the difficulty of depression or susceptibility to these deadly episodes. Since depression has various classifications, the treatment methods differ from one level to another. The simplest classification, mild depression, requires only medical assistance and self-help measures sufficient to help a person out of the blocked tunnel. But what about the more challenging cases? The book suggests a series of practical steps to help overcome depression and its risks. The most important of these include: be prepared to face challenges, recognize that life is a constant struggle, and readiness to confront it is essential for survival. Anything else is inevitable death. Take a break. In situations where you feel your mood is bad, stop everything and take a break to catch your breath, avoiding unnecessary exhaustion. Discuss problems. Most problems result from suppression and not expressing them. Storing them internally creates internal conflict, leading to anxiety, fear, and tension. Change your lifestyle. If your lifestyle is harmful to you, change it immediately. Most cases of depression result from thinking patterns and lifestyles. Exercise. Exercise is a form of discharge, expelling excess energy through engaging in some form of physical activity. Bit to remember, depression has many classifications ranging from mild to severe. Self-help in overcoming depression requires discipline in following certain steps. The type of treatment for depression depends on the method adopted by the doctor specializing in this type of illness, as well as the condition of the patient and whether their case falls under mild, moderate, or severe depression. In each of these cases, treatment requires a specific type of approach, which can be outlined as follows. 1. Cognitive therapy. In this case, the doctor works with you to address some negative thoughts that you may encounter or that obstruct your life. The purpose is to treat the motivating and stimulating causes of depression, such as negative thought patterns and life-negative ideas. 2. Behavioral therapy. Here, the focus is on what the depressed person does, not what they think. The therapy helps to eliminate actions and behaviors that lead to depression. Often, the doctor may assist in improving sleep and prescribe a suitable diet. 3. Cognitive behavioral therapy, CBT. This approach combines both cognitive and behavioral elements and contributes to treating some cases of moderate and mild depression. 4. Analytical behavioral therapy. The goal is to delve deeper into human behavior and understand its motives to eliminate it permanently. Regarding the use of medication to treat depression, there is a common belief that taking such medications makes a person addicted in one way or another. However, this is highly unlikely. Such medications are not addictive to those who take them, and their effects are only on individuals suffering from depression, not affecting healthy individuals. But this does not mean that the patient does not need to take them for a certain period. These medications leave an impact on the patient when discontinued suddenly, but that does not imply that those who take them will become addicted. To better understand how these medications work, neurotransmitter activity in the brain is low during depression. The role of these medications is to rearrange the internal structure of brain functions, thus improving the patient's condition. The action of these medications can be summarized in the following: increasing neurotransmitters producing tryptophan, avoiding damage to neurotransmitters, stopping neurotransmitters in neural synapses after returning to the cell. Bit to remember, the treatment approaches for depression vary depending on its severity, and therapeutic medications for depression aim to rebalance bodily functions and activity,